If you're someone who dreads your period every month simply because of how painful it gets, then this video is for you. And I'm not talking about those mild pain, no, or just little cramps, not at all. I'm talking of those kind of pain that will make you to cry, that will make you to skip school, skip work, or you're not even able to carry out your activities of daily living. Because sometimes those kind of pain are not normal. Hi guys, welcome back to my channel. Today we're talking about painful period and what it actually means, what could be causing it, and why we should start paying attention to it, because it's not everyone that experiences painful menstrual cramps. So now, what do I mean by having a painful period? Having a little form of discomfort whenever you're seeing your period is actually very common, and in most cases it is actually normal. But when you're having a pain that for you to carry out your activities of daily living, your day-to-day life is being stopped or it's being slowed down because you are experiencing period cramps, or it requires you using heavy dose of painkillers, not just mild painkillers, I'm talking of those strong painkillers every single time, or it even associates itself with fainting. You realize that once it's that time of the month, you are fainting, you are vomiting, you are feeling dizzy. That is the kind of pain I'm talking about, because that kind of pain is actually not normal. So now let's be honest in the comment section below. Does your period cramp prevent you from carrying out activities of daily living? Does it slow down your life in any way? Let me know in the comment section below, because one thing with menstrual cramp, this type of severe menstrual cramp I'm talking about, is that it's not just one single experience. It varies depending on what is causing it and how it showcases itself in your body. So let's look at the different types of period pain. Like I said, the type of period pain depends on what is actually causing this period. So the first type of period pain I want to talk about is primary period pain, medically referred to it as primary dysmenorrhea, but that's big English. Primary period pain. Now in primary period pain, what happens is the normal way that your body is expected to react when you are seeing your period. Now what happens when you are seeing your period as a woman? Among every other thing that takes place, there is a certain hormone that is being released, and once that hormone is released, it causes the womb to contract. When the womb contracts, blood is the resultant effect. So blood is being let out of the womb. That is the blood you eventually see when you're seeing your period. This is the normal mechanism. Now for some persons whose pain threshold or their ability to withstand pain is less in some other persons as compared to some other persons, those kind of people, it feels like they're feeling the pain more, or the experience of feel the pain more, simply because the ability to tolerate pain is actually lower compared to some other persons. There are people that if a needle pricks them, you've seen them a lot in the hospital, they are shouting and they're screaming, or if they want to have injections, medications, they are shouting, they're screaming. Why? There are people that will just stand and take it, right? So that's what I mean by that. So that's why individuals like that, when they are feeling the pain, it feels like it's much more intense, but it's actually not. It's just happening the normal way your body is expected to react. Normal things are happening the way it's supposed to happen. So there's no issue. There is no underlying condition that you have as a woman. There is nothing triggering that pain. It is absolutely normal. Okay, just depends on how you're able to tolerate pain. So this pain usually happens, you will feel it in your lower abdomen. Sometimes it will feel like it's radiating to your back, or it feels like the blood is flowing out of your feet or your legs. It's absolutely normal. These are the symptoms that usually associated with this, and usually the pain will happen first 2 days of your period, or it could happen 2 days prior to your period, or a day prior to your period. So that's actually normal. So now, having talked about the primary period pain or the primary dysmenorrhea, let's look at the second type of period pain. The second type of period pain I want to talk about is the secondary period pain. Primary, then secondary. Now the secondary period pain simply means there is something that is triggering it. It is secondary. Something is underneath that is causing you to experience a pain of that magnitude or that kind of severe pain. And the difference between this secondary and the primary period pain is that the secondary period pain, the pain is more intense. The pain is more intense. The pain could get worse as your period days progresses, and the pain could last longer. Now, in primary period pain, It's possible you experience the pain. I like to call it a mild discomfort, by the way. You could experience that discomfort the first 2 days of your period or 2 days prior to your period, and it stops there. But in secondary period pain, you are going to experience it most times the first day of your period, second day of your period, third day of your period, you're experiencing it. And apart from the fact that it is longer in duration, it is more intense, it is more severe, simply because there is something that is triggering it. It is not the natural mechanism of things that would happen when you are seeing your period as a woman. Now, one major factor or one major condition that could trigger this type of thing is endometriosis. Yes, endometriosis. Now, let me explain what endometriosis is. In endometriosis, the tissues that will grow inside your womb as a woman, the tissues that you find inside the womb are very unique to your womb. But in endometriosis, you realize that those tissues are present in your womb. No doubt, they are there present in your womb, but then they are starting to show themselves. Those tissues now decide to go and relocate themselves or multiply themselves even outside the womb. They are taking other territories that is not theirs. So you can find those tissues in the fallopian tubes. You can find those tissues in the ovaries. You can find the tissues anywhere in the body. Now, what does that mean for someone who has endometriosis and is now seeing her period? Remember, I explained the normal mechanism of of menstrual flow. When you are seeing your period, the hormone triggers your womb to contract. Now, when the womb contracts, there is the let out of blood. That's the same thing that will happen when you are seeing your period, but you have endometriosis. Your womb is going to contract. And guess what? It's not just your womb. Other parts of the body or other organs or other regions where you have these tissues that have been misplaced, they will also contract. Yes, they will also contract, and you can imagine how discomforting that can be. So now, because you have ever heard of endometriosis, let me know in the comment section below, because I would say endometriosis, the awareness of endometriosis is not common. There are other causes of period pain that is quite common, that if you mention the condition, a lot of people know that condition. They might not know that it could cause severe menstrual cramp or severe period pain. But endometriosis, even just as a condition, a lot of people don't know about it. So let me know, have you ever heard of endometriosis before? Or do you know of any person that has endometriosis? Let me know in the comment section below. Now, another type of condition that could trigger this type of severe pain is the presence of uterine fibroids. You see why I said that some conditions that a lot of people are aware of. They might not know that it causes pain that could be this severe, but they're aware of it. Fibroid is an example. Fibroid is very common, but I don't think every person is aware, or a lot of people are aware about the fact that it can cause severe period pain. So now, for a woman who has uterine fibroids, first and foremost, they are non-cancerous growths. Their growth is not small, they are growth. Okay, now they are non-cancerous growth that could be located in the womb. Anything uterine, it has to do with the womb as a whole. So they are located in the womb. I already explained the normal mechanism of menstruation or menstrual flow. Now, when a woman has uterine fibroid or this abnormal growth, this growth is located in the womb, which is not normal, right? And because there's a presence of a mass already, the growth is a mass, there's a presence of a mass, it makes it even more difficult for the womb to contract and release blood, because the womb needs to release that blood. Yes, the womb's own is that it wants to release blood, but it is finding it difficult to release blood because it cannot contract at the normal level it will contract if someone is not experiencing, if someone doesn't have uterine fibroid. The way your womb will contract to release blood, it's not the same intensity to contract to release blood when there is a mass there already. So that means the contraction has to be more intense. Do you understand? It has to be much more severe contractions to get rid of the blood. And you know definitely if the contraction is that intense, you are going to feel it even much more. So it is not a mild pain, it's a severe form of pain, and that could possibly be what is triggering the type of pain that you experience during your period. Now, One thing about this type of period pain or this trigger is that it is more painful, the blood flow is more heavier, and it could even be much more longer. Okay, another condition that could trigger the presence of severe period pain is adenomyosis. Now, adenomyosis is simply a condition where the inner lining of the womb grows into the muscular layer of the uterus instead of staying inside where it's supposed to be in the first place. So the lining of the womb, it grows and enters into the muscular wall, that's the middle layer of the womb. It is not like endometriosis that grows outside the womb. This one, it is still retained in the womb, but it grows in the middle layer, which is the muscular layer, which is responsible for that contraction. The place that contracts in the womb is that muscle layer when you are seeing your period. Now, what this simply means is that every month, that tissue that has misplaced itself, that's going to show itself, will start behaving like the normal tissues that are lining the womb. So it thickens, it breaks down, it bleeds to let out blood. That is what will normally happen for someone who has adenomyosis. So you see how challenging it can be because it is trapped inside the muscles. It will now lead to intense pain. You could feel like there's a form of pressure in your body. You could notice that the womb is even swollen because there's a bit of trapping of blood. The blood is not freely flowing out as it should when you are seeing your period with no underlying condition triggering it. So there is definitely going to be severe pains or severe menstrual cramp, heavy bleeding, sometimes even prolonged bleeding. You're bleeding for more than necessary. If you're supposed to bleed for 5 days or 3-4 days, whatever the case may be in the woman, you realize that you are bleeding for longer. And this pain can start before your period and even continue after it. You'll notice that your lower abdomen is full, you are feeling bloated. Sometimes you can even experience pain during sex. All these are associated with adenomyosis, which could trigger heavy, painful menstrual period. Another cause could be pelvic inflammatory disease. Now, what I mean by pelvic inflammatory disease is any infection that takes place in the reproductive organ. Please forget the big English, simply because reproductive organs are mostly located in the pelvic region. You know what the pelvis is? That waist region of your body, the waist, the hip, the bum bum region, all that region, okay, front and back. It is what we refer to as the pelvis, right? So if you have any infection that is affecting any of those organs there, which are usually your reproductive organs, it can cause lower abdominal pain. It can make your period to be much more painful, and sometimes there's even presence of abnormal discharge. Yes. Now, one thing I want you to note about the presence of pelvic inflammatory disease is that this disease could go on to cause infertility later in life. It will go on to cause infertility later in life if it is left untreated. I want you to take note of that. Now, a lot of people ignore infections, usually because it is not serious. Oh, as far as you are able to do one or two things, people ignore it and leave it until it gets serious. Now, I want you to tell me, do you think that women talk enough about reproductive health? Let us know in the comment section below. Another underlying condition that could trigger or cause severe painful period or secondary painful period or secondary dysmenorrhea is having an imbalanced hormone. Now, I know that when it comes to hormonal imbalance, a lot of people have heard about it, but people take it lightly. See, hormonal imbalance is not something you take lightly. As a woman, it's not something you take lightly. A lot of people experience hormonal imbalance, and sometimes hormonal imbalance is without symptoms or signs, but a lot of times it has symptoms, signs and symptoms associated with it. A lot of people just downplay it because they feel it's a normal thing or it's not serious. I think from my observation, I noticed that people only take it serious by the time they are married and then maybe they're looking for kids, or later on in life, please, even as a teenager, if you're experiencing any sign of hormonal imbalance, please go and read up about it. Please take action immediately, okay, because it can save you a whole lot. Now, what happens during hormonal imbalance? Hormonal imbalance, the hormones you normally have, they're out of place. The estrogen hormones, especially, and the progesterone hormones. These are two major hormones that are very important when it comes to menstrual cycle. Now, these hormones, they are acting out of place, and because of that, they can now cause an abnormal increase in the hormone that will normally trigger the contraction of the womb in the first place. Now, that hormone is called prostaglandins. Now, once there's an abnormal increase in prostaglandins, just know automatically your pain level is not going to be the same. Someone who has a normal level of prostaglandins and someone that doesn't have a normal level of prostaglandins, the pain levels, they are not the same. They are not the same. So realize that people who have hormonal imbalance as the underlying cause of their period pain, their period is definitely going to be much more severe. It is much more severe in terms of pain, even the rate at which it flows, the flow of your blood, the timing of your period, everything changes automatically because the hormones are being affected, because there's already an imbalance, okay, in the hormone. Now, the third type of period pain, because I've explained the primary, I've explained the secondary, of which I mentioned some conditions that could cause that secondary period pain. Now, the third type of period pain is ovulation pain. I like to call that a type of period pain. I know that people who don't call it a type of period pain, but I call it a type of period pain simply because it's associated with the menstrual cycle. Okay, so the ovulation pain, and there are people who are very sensitive enough to pick it. Not everybody that experiences it. It's not everybody that is sensitive enough to pick it up. It's not everybody, and if you're that kind of person that you have high pain threshold, you might not even notice it, but it is there. Now, ovulation pain is not exactly menstrual pain, but it can be confusing sometimes because it usually happens around the mid-cycle. That's around when you are expected to ovulate. Ovulation is simply the release of egg from the woman's body, that's by the ovaries. Now, usually this ovulation pain, you experience a sharp pain on one side of your lower abdomen, but it is not for a long period of time. It is not for a long period of time. It's usually short-lived, maybe for a few minutes, a few hours, sometimes at max a day. It doesn't go beyond that, okay? Now, another type of period pain I want to talk about is premenstrual pain. Now, premenstrual pain, or what we call PMS related cramps, is often occurs around when your period starts. So it is linked to premenstrual syndrome. So it doesn't happen on its own. Premenstrual pain doesn't happen on its own because, I mean, if you're someone who has been seeing your period for a while, at least you should be able to take note of the fact that the period doesn't just come on its own. There are certain symptoms that are associated with it. Now, one of such symptoms is bloating. You realize that you are bloated. Your abdomen is looking bigger, or your tummy is looking bigger than it would typically look on other days. You're experiencing mood swings, and people that are seeing their period or around their period 5 and 6. There's also breast tenderness. So having said all this, when should we actually take the pain we're experiencing serious? Because like I said, some persons experience these symptoms, these signs, and they don't take it serious. They believe that every other person is experiencing it. You should take it serious when you notice that all of a sudden you start experiencing a more severe pain. Remember, I talked about the primary types of dysmenorrhea, and then you have the secondary type. So if you're experiencing the primary type all of it before, and then all of a sudden the pain just intensifies, you should take it serious. If you notice that the pain prevents you from carrying out activities of daily living, please take it serious. If you notice that the pain comes with heavy bleeding, that is different from what you've been experiencing. It is even prolonged. You're experiencing a pain that is no longer than 2 days that you will normally experience. It is more intense. It even exceeds your period. Your period is over, then you are still feeling pain. Please take it serious. So I want you to ask yourself this question: am I experiencing a severe pain? Does my pain come before my period and last longer than my period? Does it come with severe bleeding? Am I experiencing pain during sex? Ask yourself that question and answer it by yourself. Then you'll know the category you fall. into. Let me know in the comment section, are you experiencing any form of painful period? What category do you fall into? Is it the primary? Is it the secondary? Is it the other types of pain I've talked about, the premenstrual syndrome kind of pain or the ovulation type of pain? Do you even notice when you experience ovulation type of pain? Because that type of pain, like I said, we have to be very sensitive to pick it up. So let me know, have you ever experienced it? Or have you been able to take note that I'm experiencing kind of discomfort and it's not my flow? That could be ovulation pain. So let me know in the comment section below.